Ascension Saint Thomas Heart has a long history of being at the forefront of cardiac surgery and cardiology and cardiovascular medicine. This program was the first place in Tennessee to perform a heart transplant, to perform a PCI, to perform bypass surgery.
We try to become best in the market and in the nation in terms of the procedures that we perform and the quality that we provide. We're proud that we have been recognized with 3 stars for coronary bypass surgery, as well as 3 stars for aortic valve replacement and coronary revascularization. We have been recognized as a center of excellence for mitral valve repair by the American Heart Association and the Mitral Foundation. In addition, we have been recognized as a center of excellence for the management of hypertrophic cardiomyopathy. So all of these recognitions allow us to continue doing the work that we do and be proud of the services that we're providing to our patients. It's all based on the patients first, listening to the patient, and treating the patient as a whole and not just the specific thing that they came to see us. We're looking at them like they are our family members. So what would I want for my family member to have if they come and see a doctor? That's the way that I see the patients every day.
At Ascension Saint Thomas Heart, we have a really great team approach to how we manage very complex disease processes, and that involves a multitude of specialties, not just cardiac surgeons like me, but our cardiac anesthesia group, who's also our cardiac ICU team, our imaging specialists, our heart failure cardiologists, and we all come together sometimes at meetings, which we have weekly, and come up with a group consensus on what is the best individualized treatment strategy for the patient.
One of the things that make our program special is our breadth of therapies that we provide. With very specialized group of physicians, we are able to attend pretty much any type of cardiovascular disease. We basically feed from each other to continue improving the techniques that we have and improving the value that we bring to our patients. Patients' outcomes and quality is our North Star. If we're not providing good quality, it doesn't matter how many cases we're doing and what we're doing.
Innovation is one of the things that drives our growth. We're one of the largest cardiac programs in Middle Tennessee, and that allows us to partner with companies in new devices and new technologies. So when it comes to clinical trials for the latest and greatest devices, we're always at the front of the line with these companies, getting to offer these new technologies to patients. Some of the cutting edge technologies we can offer includes our robotic program. We have a very robust endovascular lab. Part of the aortic program that's so great about it is that we partner with our vascular surgeons for the latest technologies in endovascular repair for stent grafts and complex work there. In addition, we have many new trials in the cath lab space for mitral clips and new endovascular valve technologies that are really at the forefront, and it allows us to offer every patient an endovascular option if they aren't a candidate for traditional open surgery.
The whole field of heart transplantation has been evolving year after year, and we got off to a good start back in 2016, and the volumes have really grown since then. We've been doing some new things with more mechanical support devices for patients, utilizing ECMO and new strategies for ECMO to bridge people to transplant. We've used the total artificial heart device to bridge people to transplant. And of course, we've been a leader in LVAD, or left ventricular assist device support, for many years.
One of the things we have led in here at St. Thomas is novel cannulation strategies, which include apical cannulation for ECMO, which allows our patients to ambulate while being fully supported on their ECMO platform, which is nice for those patients who might be waiting for transplantation or assist device.
We continue to try to improve techniques so we can treat more patients, be more aggressive with donor heart usage and mechanical devices so we can apply our techniques to more people that need it.
Our robotic cardiac surgery program is the largest in the country. We do robotic mitral valve surgery, we do robotic coronary revascularization surgery, we do robotic atrial fibrillation surgery, and then sometimes we do combination procedures where we're doing a transcatheter valve and a robotic revascularization in a patient who would be too high risk for an open cardiac surgery with a multitude of operations at that time.
We have the most advanced surgical technology that's out there with the intuitive DV5, and we were the only program in the state of Tennessee using the DV5, so I feel that we're ahead of this technology right now.
My hope for the future of Ascension Saint Thomas Heart is that we continue to push the envelope in offering novel and minimally invasive strategies in cardiac surgery, and ultimately help train the future cardiac surgeons who want to pursue operations in this way.
I'm very proud of the patients that we've been able to take care of here in the state of Tennessee who otherwise may not be getting the cutting edge health care that they deserve because they just didn't have access to it.
We're involved in a lot of trials and really doing things that have never been done before here. And I think there's going to be more of that. The volume's going to increase. We expect to do more transplants. And I think that's just going to continue moving forward.
Seeing what we've done the last 3-4 years with our robotic growth, 100, 300, and now 500 cases last year alone, the future is very bright for Ascension Saint Thomas Heart.